Hello, this is Dr. Christine Coral. I've taken a talk that I've given many times to a lot of therapists who've wanted to learn how to do online therapy, and I've updated it recently for all the people that have been contacting me asking for an update in light of taking their practices online very quickly thanks to COVID-19. So what I want to do with this version of it is to give you a very quick introduction to online therapy, some of the ethical concerns that you should be thinking about. In the second segment, I'm going to get my husband, who is Doug McLaughlin. He's VP of Professional Service at ITK Consulting, works a lot in tech. He's my tech support, so he's going to talk with me about some of the concerns, some of the questions that people have had about more technical issues, although you don't need to be intimidated by it. I think that's going to be the message today, that there's nothing too scary about delving into this. There's a few things that you need to know and to prepare for, but we all got through grad school, so we all have the training and wherewithal to be able to do this well. So I'm hoping that this quick introduction to best practice in online therapy, the ethical issues that you have to think about, will be a quick start for those of you who are jumping in very quickly because you have to bring your practice online. So just like in-office appointments, we think about a lot of the same things, the same ethical issues when we go online. And we need to think about how we assess our patients, particularly if we're doing telephone sessions and we can't see a new patient. If it's a patient that you know quite well, then the transition I find is much easier to go to online or to telephone sessions. You've already built that rapport, but it's certainly not impossible, and it can be very helpful to people if you can connect with them in some way. There's lots. We'll talk a little bit about the research about how people do with online therapy, and the results are quite impressive, so there's no need to worry that you're doing less. But with assessment, you don't have quite the same information that you get when you're in the room with somebody. Like if their hygiene is poor, you're not going to be able to smell the body odor, or you might be seeing from the neck up. You might not see how clean their clothes are. Some people actually recommend having people hold their hands up to the camera so that you can see their fingernails and what kind of shape their hands are in. But there's other things that you can get that you wouldn't get in the session. Like when I work with OCD patients, I can see where they're living. I've had people take me on a tour of their house. I've helped them with exposure in certain areas of their house, so I don't have to do a home visit. That wouldn't necessarily be the assessment. We're going to talk quite a bit about informed consent and what needs to be included. We're going to talk about your online presence, jurisdiction issues, and so on. So we're going to get through all of these different topics, these ethical issues, and that'll be the first part of the webcast today. So just so that you get that quick overview of what are the things that you need to think about before we talk about how to do online therapy. So let's talk first about the first bit of assessment that you actually need to do is decide whether or not online therapy is appropriate for a particular client. Now, it's not just whether or not they would be okay online, but do they have good internet access? Are they comfortable with technology? Will they be able to use it safely? Do they understand if you use Zoom or some other video link, are they going to be able to do that? Many people use that for work all the time, so they're quite comfortable with it in their transitioning to therapy. Other people have less comfort and less experience with that. You also have to see if they have good enough internet access, and tell them to make sure that nothing else is using up their bandwidth if they're having trouble. A lot of the platforms are actually quite good, and they adjust. They will take a lower resolution image if they can see that someone has a slower internet connection. But still, you want to make sure that that's in place. It's also good to ask why they're interested in online therapy. Now, if you're doing this because of coronavirus and you're jumping into online therapy, that's going to be the reason why. But sometimes when you're doing this as part of your regular practice, sometimes people are doing this because they have a hard time getting into your office, or they have some social anxiety, or they just may be busy and this is a way to fit it in, to make it, or they have small children and it just saves them some time to be able to get in and see you. The other thing that you need to plan for, especially if the person is outside of your community, your immediate community, like they're in a rural or a remote community in your jurisdiction, you need to have make emergency plans. So do they have a physician? Usually the family doctor is a good person to be able to connect with if you're concerned about them, and they can make sure that the person is safe in the event of a crisis. You also want to make sure that you have a way to connect with the person if you get disconnected online, often using telephone as a backup. So I always let my clients know that we're going to do our best to do the video connection, but if it fails, I'll be giving you a call at this number that I usually have on their file. The other thing people ask me a lot is, what about symptom severity? Are there certain patients that are just too severe for online therapy? And I always tell them that depends on your clinic and what you're doing. When I was working at a hospital, I felt much more comfortable seeing patients with higher levels of severity because hospitals open 24/7. People could come in and to the emergency room and get help right away. So it's not symptom severity doesn't necessarily preclude you from being able to offer online therapy services. It just depends on the kind of clinic that you're working in. You might shy away from that if you're a solo practitioner. You might choose to only treat people who are relatively stable and you weren't worried about their suicidality, or being able to intervene if something difficult came up for them in the therapy session and they were far from you. So you can make that judgment based on not only the person, but the setup that you have in a particular clinic. And the other caution is, making a diagnosis without any nonverbal cues. You want to be able to, especially if you're doing telephone therapy, you might be able to provide some service and some crisis support online, but possibly stay away from making a clear-cut diagnosis if you don't have all the information that you need. So just be wary of that. So the other issue in doing online therapy is making sure you know who you're talking to. So in some cases, depending on the kind of assessment that you're doing or the kind of patient that's coming to you, you might even want to ask for ID and have them hold up ID to the screen so that you can verify their identification. You want to make sure that their communication channels are secure so they're not sharing a connection with somebody else, or even sharing devices sometimes with somebody else can be problematic if other people can get in and see maybe what you're emailing to each other or when they might have an appointment with you. Some people also use code words. That could be, especially like for email communications, code words or special images that they can include, or you could have like use numbers as sort of like a password that they use with you. So you want to make sure that the email you get is from that person who's actually sending it. I once had someone's ex-husband send me an email pretending to be the ex-wife. And I was suspicious, so I called her and she's like, nope, I didn't send that. And she figured out who it was. So fun stuff. It's always good to be a little bit suspicious with the email communications if you're doing email therapy with a particular patient, that you're actually talking to the person that you think you're talking to. Now, the other side of this is, once you've decided that it's right for the client, you have to decide if it's right for you as a therapist. So some of the qualities that the therapist needs to have is the ability to keep up with the latest research, on online therapy and trends in technology. So some comfort. You don't have to be like a techie. Like, I don't think of myself as a techie at all. In fact, I can be quite lazy because I do have my tech support at home. I like this stuff, but and I can get on top of it, but I always have to ask lots of questions. So just a general interest. You don't have to be the most technical person in the room. This is achievable for most of us. Generally, you know, a lot of what I've read about getting comfortable with online therapy is if you're not afraid of online banking or using the internet, then you're probably okay to do online therapy. If online banking makes you nervous, then probably you have some discomfort of technology that might make it difficult for you. The other thing to keep in mind is you should have some comfort working without visual cues. Sometimes if the technology isn't working and you move to the telephone, or sometimes if the person's bandwidth isn't great, I'll actually tell them and I'll close off my camera. So that makes it a little bit easier than we just talk online verbally. You know, you don't get the video, just the audio. And that can sometimes improve your connection if it's a bit choppy. You want some basic computer skills. You want to have a rudimentary understanding of encryption. When Doug comes on, we'll talk a little bit about that. That's nothing to be too scared about, but you want to know what encryption is and know what parts of the communication and data record need to be encrypted. And then if you're doing email therapy as well, you know, usually I supplement some of what I do online with some written communications and emails that are encrypted emails that I send to them. So you want to have some good written communication skills as well, depending on how you work online with people. I tend to supplement what I do with emails in between therapy and sometimes just email therapy with some people. So if you want to do that as part of what you do, instead of just using the telephone and the video, then you want to make sure you're comfortable there. Now, the other piece of security that you need to keep in mind is the security on your device. So what you want to know is where is whether it's your laptop, your iPad, your phone that you use to access, you know, either your practice management record or Zoom or Skype for Business, whatever you're using. You know, a lot of these programs now have apps that make it easy to just use on your phone or iPad. You want to know where that data is being stored and what are the settings on your devices. What have you shared with other apps? And so you want to be able to go in and check your settings. You also want to be careful about what apps that you use on your phone, because sometimes if it's not a reputable company, sometimes you can have what's called a Trojan horse on there, and that will get into your phone, and it's kind of like malware that gets on there, and they can access other, they have you download, like, I don't know, some game, but really also what's coming in there is the ability to access the rest of your phone. So you have to be careful with that. In some cases, you want to cover up the camera when you aren't when you aren't using it. Sometimes cameras can be hijacked, and other people can see in to your room or watch what you're doing in your room. And then it's a good idea, I say here, annual checkup, like go through your privacy and look at your sharing on your phone and see what's shared. At least annually. I do it a lot more often than that, or each time I download an app, I'll double check because I'm mindful of it. The other way you can see if something's funny on your phone is your bill, and see what subscriptions or funny charges you have from that. So if you check your Apple account or Google account, you can see what is not appropriate on your phone. So I'm going through these quite quickly. You can obviously like rewind and, you know, go back and look at the parts that you might want to hear again. But I'm giving you a lot of checklists, and so feel free to like dive deeper into any of these if you're not sure. But you know, these are pretty quick things that you can do. You don't have to do it all at once either. If you can start to, you know, check your devices, learn about encryption, Rome wasn't built in a day. A lot of people are feeling pressure to do this quickly and be set up tomorrow so that they can give their clients options if they have to quarantine quickly. But know that, this is doable, this is achievable. You don't have to be too overwhelmed. So one exercise that I like to do when I've run live workshops, and you can do this at home and pause your screen and see for yourself. So the exercise is to check the privacy settings on your phone. So whether you have an iPhone or an Android, or what's the other one? I can't remember. I'm going blank now. You want to go onto your phone and see what apps have permission to see your photos. So just your photo library. And that's different than what apps have permission to access your camera and can view through your camera. And then also see where your photos are stored. Are they on your device or on a cloud service? So I want you to go play with your phone and see if you can figure this out. And every time I do this with a larger group, the therapists are always surprised to see where exactly their photos are going. There's a few people on top of it, but a lot of people are like, oh my gosh, I had no idea. Like, there's no reason for this app to have access to my photos. So we give a lot away with the apps that we download. And there's a lot of trendy kind of apps that get out there. And it turns out, I think there's like one app that you could take and it would age your picture, but it was like getting access to your entire photo library. And often like we take, screenshots of things that we want to try and remember, or pictures that maybe we don't want to share with other people. There's a lot of personal information with that. So you always want to be wary, of fun apps that are free and get a little bit viral. They're not always the best thing. So pause the talk for a little bit and play with your phone and see if you can find that, and then come back. So assuming you're back, the next piece here is informed consent. So when I was preparing for the update of this talk, there's a Facebook group of therapists I belong to. They asked me a lot of questions. I had some other colleagues in other provinces also connect with me because they know I do a lot of these workshops. So everybody wanted to know what to include in the informed consent. And it's pretty easy. There's a lot of recommendations. APA has some recommended practices for your informed consent. I believe the Canadian Psychological Association has some too. And there's health authorities that have given ideas. So I've kind of compiled some of the basics from all of these. So essentially you want to let people know that online therapy is a relatively new treatment. Although it's been around for about 20 or 30 years, telehealth actually isn't that new. So there's quite a bit of research showing that there's good evidence to believe that online therapy can be as effective as face-to-face therapy. So that surprises a lot of therapists. And the feeling of connection to the therapist, therapeutic alliance is quite high, even for email therapy. Video therapy, absolutely. But people, in addition to really being an effective form of treatment, people really love the convenience. And so once they try it, even if they might not have wanted to do it in the beginning, they end up quite loving it. And because I'm so comfortable with it, I always offer it to my clients if, say, they've forgotten an appointment and I call them. I'll say, do you want to do a phone session? I don't want to charge you for a no-show. Or, sometimes they can hop on and we can do video quickly. Usually if it's last minute, I'll offer phone. And if they're not set up with Zoom, if I know they're good with Zoom, then we'll do that. But after I have a few of these appointments that are forgotten, usually people are hooked. They really do like it. And so I would say now, like before coronavirus, I probably any given week would have probably 20 to 30% of my clients would be online in my private practice or by phone because they were just so used to it. So usually, sometimes they come in, sometimes they don't. Maybe like 10% are from outside of like to enroll in remote communities. I have a few people, and a few people I'm registered in 2 provinces, so I have a few from the other province that I'm registered in. So that's a smaller piece. I would say most of my online people are local, and they're just having a busy day, or they forgot their appointment, or sometimes they plan for it just to save the travel time, and they quite like it. The other thing to put in your informed consent are how to handle miscommunications. If you're doing email therapy, obviously, something can be taken the wrong way or taken out of context. So you want to put in your informed consent, please give me the benefit of the doubt. But even in video or telephone, things can be missed. It's not quite the same as being in the room. So you want to let the client know that this can happen. Please give me the benefit of the doubt. And, bring up your concerns so that we can work through any miscommunications together. The other thing to include are insurance and coverage of fees. So sometimes insurers are getting better about this. I haven't really had anyone recently tell me that their online therapy was rejected, but they should double check, depending on where you are and whether you're in the US or Canada watching this particular video. Some insurance companies won't, so they might not get reimbursed. So you just want to double check that and give them the heads up in your informed consent, but they're still responsible for paying whether or not their insurance covers the session. You want to warn them about confidentiality and privacy. Obviously, you'll be in a private room when you do your online therapy, but they might not think about those things. And so you have to tell them that they have to, therapy is important. It's important that they have some privacy, that nobody's going to be walking in and out of the room, that if there is someone else in the room, you want them to identify themselves or come on camera. So you're not having a session in front of somebody else, and to give them a heads up about all the things that they need to do to stay safe and have an effective therapy session. You can also add to your informed consent. A lot of places recommend adding the pros to online therapy, and that it's convenient, no travel, it's good to reduce greenhouse gases, reduces our CO2, our carbon footprint. That's the word I'm looking for. And if you're doing email therapy, that one of the pros is that they can review the material as often as they like. Also, you want to tell them what security measures you're taking so that all written, audio, and video communications are encrypted. And you want to talk about backup communication if the technology fails, and what you're going to do in case of an emergency if you're worried about them. Who you're going to call. I'm going to call your family doctor, or I'm going to call the emergency room if I'm concerned about you, so that they know that you have a plan in place should you worry about their safety. You also want to put in the informed consent, you want to clarify your availability. So they don't expect that you're going to respond 24/7, that you're going to respond during normal office hours, or when you're returning calls, that you're going to try and return calls and, depending on how often you do it, in 1 or 2 business days. You also want to, if you're doing email therapy in particular, sometimes people will send you their encrypted emails throughout the week. You can let them know I'm only going to respond, like my email therapy day is Thursdays. So that's when I'm going to respond. So they can send me email communications. They can send me their homework as long as they're using encrypted email throughout the week, but they know to expect my response on a particular day. So I'm not constantly chatting with them. And then how your data is stored, so that they have not only that are all communications encrypted, but storage is also encrypted as well. Okay, so that's a lot to put in there. You can find different examples online. I'll leave it to you, and there might be other requirements depending on your college or regulatory body. So double check, but looking at a few different sources, these are the top things I could find to include in your informed consent. So next we have maintaining clinical records. So here, whenever I've done this, like a few colleges have hired me to give this talk to their registrants. And each time they ask me, please talk about clinical records. So this is a big concern of most colleges. They want to ensure that, any communications that you have, not only your clinical notes, which obviously we write after a session, but any email that you have with a client needs to go in the clinical record. You need to document all phone calls. You need to, any attachments that they send you or need to be included. If I use a practice management software that lets me snap photos, so if people bring even homework into the therapy session, I'll snap a photo and it goes straight into the clinical record, not into my photo library. And then, or if we use my whiteboard, I'll take a snap of that and put it in the clinical record too. So that's more for face-to-face, but you can save those sorts of things as well in your session. But any attachments that they might email you needs to go into the clinical record, and text messages need to go into your clinical record as well. So if you are using text to communicate about appointments or doing text therapy, there are some secure ways of doing that with using texting with people. That needs to be saved as well. So that's my fulfilling my request to most colleges who want you to be mindful of all the little bits of information that you collect. So next is jurisdiction. So it is really I don't know what the word is, tempting, frustrating for a lot of us who want to offer our service, especially if you have a particular area of expertise that is not easy to find. People may contact you, for those of you who've written books on a topic, people may have contacted you, but you do have to stick to where you're registered in terms of practicing. So I'm registered in 2 provinces. I'm registered in BC and Alberta at the moment. So I can offer services in those 2 provinces and not beyond. Yukon doesn't have a Psychologist Act, so where there's no regulation, you can practice. I don't offer services up there because there's other reasons why you might not to. I don't know the local resources. I don't know who I would necessarily contact. So I'm kind of unfamiliar. I've lived in both BC and Alberta. I kind of know both the health systems. I feel comfortable in both of those areas, but Yukon where you can practice, but there's other people who live in northern BC or northern Alberta, and they may be quite comfortable. They might be familiar with the area, or you would need to get to know the area. If you ignore that and you see somebody anyway, you can get into some trouble. There's been some stories of countries that have banned people. So if you've ever thought of moving there, you want to move to Australia and they find out they're not so happy with you, that you offered services. Some people take the risk and try not to get caught. I don't think that's a great idea. Sometimes you can get temporary permission to do that, but you always want to check with the jurisdiction that the person is in. And if they are outside of your jurisdiction, then you won't be able to offer services. Have them find someone local. You also may not be, even if it's a lot of people are tempted to help somebody who's an expat in another country, so a Canadian or American visiting somewhere in Asia, you might not have the cultural sensitivity to be able to help them ethically and safely. You might not know. And then who are you going to contact if there's a duty to warn in any particular situation? The other issue is your insurance might not cover you. So just best to stick to your jurisdiction. So we'll move on. And then you want to have good standard operating procedures. So this is how you know what you're going to do in given sticky situations when they happen. So I kind of mentioned that in the informed consent, let people know when you're available. So set boundaries and limits on that and let your clients know. To know what you're going to do in an emergency, what's your emergency plan? There's a lot of similarity between what you're going to do in an emergency, after hours, and that most of us don't provide 24/7 hour care. We're not that part of that clinic. There's some DBT clinics that might be an exception to that, and they have someone that you can call. But most of us are not going to be working late into the evening, and so you have to let people know that they need to go to their nearest emergency room or call the emergency line, their local health authority. It's also a good idea to let people know what you're going to work on together. And so what is the plan for therapy, so that there's some boundaries there? Because with online therapy, you can feel very much like, when you come to your office, that's a very professional interaction. You're clearly coming for a service. When people are at home receiving treatment, there's a little bit more disinhibition, might feel a little bit more comfortable. This is sort of a known thing in online therapy. So you want to have clear boundaries, that this is very much treatment and not a social visit. So you can increase the professionalism of that interaction by being very clear about what you're going to work on, what your treatment goals are, and how online psychotherapy works, what to expect in those cases. Okay. So going into that, the fact that you're going into their home, online or on the phone, and sending emails possibly, you want to review your online presence, because they're online connecting with you. They're going to start, the clients often will start to look at your social media. So you want to, I see that didn't format well. Set clear boundaries, include in informed consent. So you want to also include, I think it's a good idea to include that, you're not going to connect with them online. If you have a Twitter account that you use to promote good mental health education, you can, they're going to follow you, but you're not going to follow them back if they're your client. Although I've had people on LinkedIn mostly who've, my LinkedIn is a bit crazy. I've got a lot of people that I don't know on my LinkedIn, and sometimes people have connected with me on LinkedIn and then years later become my client. They were thinking about it sooner. I kind of treat my LinkedIn a little bit differently, because I don't know most of the people on there, and I don't post a lot on LinkedIn. It's pretty much just my CV. So the way I look at it, it's just an online CV. They can see I'm legit. I'll let people know, though, that if they ask me to introduce them to someone on my LinkedIn, that if they happen to be on there, if I've caught it, usually people don't bring it up, that I won't introduce people to each other on LinkedIn. I tend not to do that. So if you see someone on my LinkedIn, don't assume that I know them or that I'll introduce you to them. But other social media, obviously Facebook, you want to keep that somewhat private. Some people have a Facebook clinic account where they post information. That's a little bit different. You're keeping it professional. That could be part of your marketing. But also, you don't have to have an online presence. You can, market your practice and do lots of things without an online presence. That surprises some people. I think there's a lot of good reasons to use social media and understand it, simply because our clients have so many experiences. I think it's good for us as clinicians to understand, the pros and cons of social media. Also, sometimes clinicians try to use a fake name to protect themselves, and it doesn't necessarily protect you because you've used a particular email to sign up, and so many things are interconnected. So many websites are interconnected, and Facebook gives your information to lots of people. So sometimes people will figure out it's you. So all the fake name does is give some plausible deniability. If you use some version, I kind of misspelled my last name on my Facebook. People can probably, my Facebook's kind of boring though, can figure out it's me. So you want to you just keep that in mind. It's not necessarily protection. People can still figure out it's you, but it does give some plausible deniability as to it being you, especially if you change some of the photos. You also want to make sure that you're careful that everything you post, you can imagine it being on the front page of a newspaper. So it's all public communication. I actually even do that with clinical reports. If I just assume it could be photocopied and disseminated everywhere. So I'm careful in how I word things, and you keep it respectful. Same thing with online. People can take screenshots of what you've done, even if you've deleted it. So keep it classy. And then with patients too, I also do a social media assessment with them. I see, how are they connected online? Are they comfortable with it? Is it causing them any stress? Especially if people are unhappy with their job or looking for work, I'll often teach them how to use LinkedIn to connect with people and network and find jobs. So I should do a workshop just on that. That's a fun thing to do with people. Or if they have social anxiety, it can be sort of a baby step. So there's lots of good things about social media. So I like to assess my clients' use of it. But don't cyber stalk your patients. So don't go looking up. Like if I do look at, as part of the social media assessment, somebody's account, they're with me. They're showing it to me. I'm not going to, and it's for a therapeutic reason. I'm not going to go and check on my own to see if they are doing things. I don't know why, though. The icon, I had a lot of fun with playing with Microsoft's PowerPoint's AI on this particular presentation. It suggested all these icons. I didn't spend hours doing this, so they're all pretty good. But I don't know why the X-ray icon for this one came up. Maybe the word patient brought that up. But anyway, I'm just noticing that now. Anyway, I didn't choose that. The AI on my Microsoft Office did. Okay, so to wrap that up, you want to have social media policies and practices. You want to be a good user of social media and understand it so you can understand your clients' experiences. You want to have clear boundaries about friending and following. You want to watch your public conversations. You don't want to ask your clients for endorsements or, give weird endorsements yourself, and fake names and pics, fake pictures, that, are of someone else or your dog. Give some plausible deniability, but not complete protection. The privacy settings are always changing on social media. So just when you think you set it, Facebook's changed something and people can see, suddenly, friends of friends can see, your posts and you didn't realize you could, or someone tags you. And then it's often you don't realize, client is actually, we have a mutual friend with a client that you didn't realize. That can happen too. But there are a lot of potential benefits. So that's why it's a good thing to be able to do this. If you're going to be active on social media, education and advocacy is a great thing to do to get good health information out there. Just make sure you don't complain about your clients or your patients or how rough work is. That could be something that could be problematic if we all get really busy or have trouble, with working online and we complain about it online. Probably not a good thing. You also, when you post, want to check the background of your photos. That can be problematic. I had one friend who posted something. She was in a meeting, and she just posted a nice pic of everyone in the meeting with her, but not realizing in the background there was the password for the secure Wi-Fi in the building and the key code to get into the building. So I just texting her madly, and I'm like, I just saw what you posted. And so she's like, oh my God. And so it was taken care of, right? She had to let security know, and they changed the passwords, but, caused a little bit of a pain. So be very careful, that you always check the background of your photos. Stranger danger. Sometimes, if you're doing some work from home, people might be able to figure out where you live based on little clues that you didn't think about. Also watch your location settings. Sometimes they get posted as well, so people can see where you took a particular picture. So if there's certain things you want to keep private, and always check your privacy settings. So that's kind of a good summary of sort of the ethical issues that you need to keep in mind while you are getting ready to go online. You could always dive deeper into each of these. In the next section, we're going to talk more about how to assess the software and apps that you want to use in your practice. How do you know something's safe? People are always asking me for recommendations. And instead, what I end up doing is teaching them the process of being able to decide for themselves whether or not something is safe to use. So we're going to go through that next. I'm going to go grab my husband. I'm going to break up the video into 3 parts so you don't have to watch it all in one sitting. But go on to section 2 when you're done with this one. Thanks.